Welcome to the Business Growth Spotlight, where we shine the light and talk with business leaders from all over the world who are here sharing their expertise and wisdom so we can all grow together. I'm your host, Heidi Schalk, co-founder of HLH Growth Solutions, where we help businesses scale through AI solutions and visibility strategies. If you're new to the podcast, welcome. I'm excited to have you here. Stay to the end because we have a special gift just for you. But without further ado, let me introduce my guest today. She is Dr. Cristin Dickerson with Green Imaging. So welcome, Dr. Dickerson, to the podcast.
Thanks for having me today.
I'm thrilled to have you and talk with you. So Dr. Dickerson, can you share with us a little bit about yourself, about Green Imaging, and your role within it?
Sure. I'm a practicing radiologist trained at the Texas Medical Center, and I ended up going to work for a big multi-specialty group that was in the Texas Medical Center because I went there because I just wanted to practice radiology. I didn't want to have to do the business of medicine. And so ironically, within a few years, I was managing partner of that clinic because we had a new billing. I would work nights and weekends at the hospital, and we had a new billing manager who came into my office one day and brought this big box of what we called yellow tickets. And that was the work that we did over at the hospital. That was when I was away from my kids, nights and weekends, in the middle of the night, going and doing an angiogram at the hospital. And the hospital was not giving us enough information to bill for those exams. Literally, we had millions of dollars of studies we couldn't even bill for. So I decided I had to practice the business of medicine. And really, that was my MBA. I had a CEO and a CFO and really learned the business of medicine and took it even further. We were the first digitized radiology practice in the Texas Medical Center. It was really fun to be innovative. I had the right people, and it was a great way to practice medicine. It was a great model for medicine. People would come in from Louisiana and from all over Texas. They could come in for a full day, see their internist, see the subspecialists they needed to see. They would get their labs, they would get their imaging, and they would go home and feel great or have a new diagnosis and be on the track to getting better. We all ate lunch together, discussed patients. It was a great old-fashioned way to practice medicine. It's too bad we don't have more of that now. But it was a great experience. And as I went out, they ultimately sold part of the company or merged with the hospital system, and they took over the imaging. And so we had already started, when we became digitized, we had too many radiologists. We weren't having to hang our own films anymore. And so we had already started a radiology practice. And so, I went along, we were practicing, we're reading images for facilities all over the city and even throughout the state. But ultimately, I would have friends call and say, "Hey, Cristin, do I really have to pay $3,000 for an MRI?" And the answer at that time was actually yes, because the chain of imaging centers that was in network with the insurance companies was purchased by a hospital system, and the prices tripled overnight. And everybody else was having to operate. There were still out of network benefits there. Everybody else was operating out of network because the in-network payment was so low. And so if I just built an imaging center, I wasn't going to solve that problem. And so I got the idea, like Travelocity and some of the other models where they're using unused time at a facility. If you get a hotel room through Travelocity, it's just a room that the Hilton couldn't book themselves, and passing, any savings along to patients. So I went to the imaging centers I was reading for and said, "Hey, let's try this. Let me try sending you some patients. And how much would you charge me for the scan?" And so we leased their extra time at these facilities, pushed it to our PAC system. We, as radiologists, read the study and passed the savings along to patients. And we did that initially for self-pay patients, but ultimately I had been a self-funded employer when I was running the health plan for that multi-specialty group. I saw that this could help employers tremendously. And so we moved very quickly into that space. And now we're in 50 states, over 6,000 facilities nationally, and have about 3 million covered lives, people who are using green imaging services through their employers.
Wow, you've grown in a big way.
We've grown in a big way, and we've done it right. We've done it slowly and, over 15 years. So, and the model, is right now for the kind of healthcare economy that's emerging. Things are changing very quickly, even this week, even today with the decisions in Congress.
Congratulations on that growth in a short amount of time, in 15 years. That's still fast,
Yeah, it is.
So what well, I think you've told us what motivated you, but if you can go deeper, what motivated you to challenge the traditional healthcare system by founding Green Imaging?
It was really, really broken. I saw that the imaging centers I was reading for, had something that was over ordered, like a CT of the chest was ordered without and with contrast. It never needs to be. It either needs to be with contrast or without contrast. And, they wouldn't really, in an ethical place like the multi-specialty group where, we were running the show, I could downcode that. I could say, no, this 16-year-old only needs without contrast. And we, half the radiation, no contrast risk, and decrease the price. I wasn't in control of how things were working from, an ethical standpoint. I wasn't making sure prices were aligned, with what the employer should be paying and what the patient should be paying. There were just too many things that I couldn't control when it wasn't my practice, when I was just a contract radiologist. And so I wanted to inject that goodwill that, really I wanted to be a doctor practicing my own kind of care. And I found that I could do this through this model.
Yeah. So you mentioned, the pricing a few times and the cost. And it used when somebody said, does it really cost 3,000? And at the time it did. Many people don't understand, and I'm one of them, the difference between buying healthcare and buying health insurance. You think it's the same. So, or at least we think it's the same, not you, we. So can you explain the distinction between buying healthcare and buying health insurance?
Sure. Let's think about auto insurance. We don't include oil changes and banging out a dent or a cracked, sometimes, windshields are a little different, but a broken window. We don't include those things. Those are not things we expect our auto insurance to pay for. We buy the auto insurance for the catastrophic event, for the big wreck, for somebody being injured. That's what insurance is for. It's to cover something catastrophic. We've got to go back to separating. And the Affordable Care Act it really was intended to help things. And it did. It brought people who were just priced out of the market, high risk people. It got them coverage that they needed that was being denied elsewhere. But what it did was, in trying to get people care, they started lumping health care into health insurance. And people have that confused. Buying healthcare in this country is actually pretty affordable if you're willing to go across town for it, especially, not just next door. There are options. There are cash pay options throughout this country for healthcare. And they're really great ways to acquire care, especially primary care. And we can talk about that. But what we have to do is separate out paying for healthcare and paying out our catastrophic coverage. And there are lots of options for catastrophic coverage now. There are more than there used to be. There's traditional insurance, and some people need an Affordable Care Act plan because of where they are in their health. But there are also entities, they're non-Affordable Care Act health plans, and there are short-term insurance plans there. And then there's health sharing. And health sharing is something that churches and religious entities did a long time ago, but now it's opened up to employer communities and to individual communities. And it's a really great way if you don't have catastrophic, if you don't have an existing catastrophic issue, to purchase catastrophic coverage in a much more affordable way.
So where would somebody go? And I'm guessing that you talk more into the employer, not the solo person, correct? We're talking more about some.
No, it's across the board. I mean, okay. And most people in this country of working age get their health care from their employer, more than half. So I'm talking about those people, but we have a whole gig economy where people are getting health care, buying health care on their own. And actually, the book I wrote last year, which is called Aligned, it's about aligning the interests of patients and doctors and employers, because they're all in this mix. They're all stakeholders in this mix. And really, people sitting down and putting pencil to paper and calculating what they're actually spending on healthcare and what they're spending on catastrophic coverage, and seeing if those align or if they need a different kind of catastrophic coverage. And it's really interesting. People don't realize how much they're spending on care before that insurance plan ever helps them. They've got to get all the way to that deductible. You've got all these copays along the way, and you've got this insurance premium. Then you may have family maximum out of pocket of $10,000, and then co-insurance on top of that, on top of the deductible. People don't realize how much they're spending on care, and the insurance isn't really doing anything for that. And so higher deduct, really figure out what you can tolerate. How much do you have? Could you spend $5,000 and get to that deductible, or do you have to have a lower deductible in case something happens? Should you be going for that higher deductible and tucking away money every month so that you can tolerate that $5,000 deductible? There are a lot of different ways to do healthcare. And I really, in that book, I have some formulas so people can read it and say, hey, maybe it would be better for me to subscribe to primary care, make sure I'm taking care of all my healthcare needs, and get a catastrophic coverage that's more affordable. So there are lots of different ways to do it.
And since you brought up the book, let's talk about that. And then my follow-up question is going to be, you mentioned primary care before and some options there that people can look into that they may not know about. So I don't want to forget that, but where can people find your book, Align?
It's on Amazon and Barnes and Noble, both.
Okay, perfect. So those of you listening, go grab it, go check it out, go get it. There's Cristin said, there's formulas in there that will help you make the decision. Right now, when we're recording, we are in the end of open enrollment. I'm talking to my agent tomorrow. So this is great information for me to be going to her. It's very timely for me. So when this comes out, you may want to be either planning for next year, or depending on your situation, it might be the right time for you as well. So make sure you go check out the book Align, either on Amazon or Barnes and Noble. So can you talk to us, Dr. Dickerson, about the primary care that you had mentioned and some options for that? Because I don't have any idea what other options there are except for my quote unquote insurance.
Yeah. One of the things that's happened is that primary care doctors do not get paid well in the existing system. They have to see more and more patients because of that, because they don't get much for an office visit. They have to churn more patients. They spend less time with you. I think the average time that they really interact with patients now, and they're not typing on a typewriter, is like 6 minutes and for an office visit. And then you go get these tests done, and then you got to go back to see them again to get the test results. None of that is efficient. And it's not really looking out for your long-term care. What subscription-based primary care makes a lot of sense, and it's called direct primary care. And there are lots of permutations of this going on throughout the country. There are people who are doing women's care only. There are specialists who are doing only women's care. There are ones who are taking it from a sports standpoint and looking at diet and the musculoskeletal growth and fitness. And, there are people who are specializing in DPC in different areas, but there are also just family docs who do it. I would love to go back and do direct primary care. I'm licensed in the state of Texas to practice primary care. So I'd love to go do that someday, because it's relationship care. And so you pay a monthly fee and you go and get an in-depth, usually the first exam is about an hour. And it's not just an exam. They're going to talk about financial health. They're going to talk about emotional health. They're going to talk about physical health, all of those things, because they all are the whole health of the person. It's a much more holistic approach to healthcare. And then you have access to that doctor 24/7. And, my friends who practice this way, people are like, do you get calls in the middle of the night? And they said, it's amazing how respectful people are. Yeah. If I get a call in the middle of the night, it is a call that I need to take. And and they also, if you end up in an emergency room, you pull in your DPC doctor and they can talk to the ER doctor and say, hey, yeah, she's had an arrhythmia. She's on these meds. This is what we've done. These are the testing we've done, so that you're not repeating care that you've already, maybe just had. There's so many things. And then the other thing is, when you need other care, most of these DPC doctors are building networks of affordable care. They know about green imaging. I don't know how many DPC doctors we have in our navigator portal who come in and bring their patients our way, send the order our way. They follow the order throughout the life cycle of the order in our portal. And then if we read the study, a link to the images and report go back to them there. So, they're Sherpaing the patient through the entire healthcare experience. And even, I love this part of it, when there's a specialist visit, if it's a remote visit or a consultation, an e-consultation, the DPC doctor and the specialist can both be on with the patient. And so the DPC doctor is really hearing not from you what the specialist said or from some EMR summary that's very hard to read. They're actually hearing the words that the specialist is using with you and can say, hey, but what about this symptom? And really you get the most out of healthcare that way. It goes back to that multi-specialty group where we sat down and lunch and talked about patient care. It's really a much better way to practice. And so, their goal is to get you off of medicines, to get you out of the care that you don't need and on the care that you do need, and much more affordably. So it's really a much better way to practice.
I know of one doctor locally that does that. And that's because a friend of mine has been with him for, I would say 10 years now, at least I would say about 10 years now, doing that exact subscription based. She pays monthly, but she always has access to him with a question or anything. And of course, yeah, people are respectful. And the great thing about for the doctors is they don't have to see as many patients.
Right. They can handle about 1,000 patients. Right?
Yeah. So they get hopefully some of their work-life balance back.
Right.
Yeah. So Green Imaging offers transparent, affordable imaging service nationwide. You're in all 50 states. What do you see as the biggest barriers patients face when trying to get high quality, fairly priced care?
Being sent down the hall from their doctor at the hospital or the clinic. A lot of times, the imaging centers they're sent to are hospital joint ventured or owned. They don't even have that on the door. I've been sent by my kid's pediatrician to a Texas children's facility. There was nothing on the door that said that, but it's the most expensive, hospital imaging in our city. And so you really have to be careful where you go. We do that on behalf of patients. We do assure quality in very different ways. Number one, we read almost 50% of the exams performed in our network. That means we're seeing how not only that machine is operating correctly, but that the tech positioned the patient properly, the proper protocol is followed, and we make sure the right radiologist reads it. And so that is very different than just a listing of imaging centers that's in a network. We're actually, even if we're not reading it, we're protocoling the exam. We're making sure that CT of the chest doesn't get done without and with contrast, that it's down coded to whatever's appropriate, either with contrast or without contrast. If it's ordered as a CT scan and it should be an MRI, we are going back to the referring physician and saying, hey, this is a much better test for this. May we change this order? So we're really assuring quality in very different ways than the traditional network is. But people are so used to going down the hall. Where's the most expensive place to get an MRI? It's down the hall from your doctor. People are used to the traditional system. They don't know how to change that. And that's where I think the direct primary care doctor can come in and, relocate them. I think, it's also just taking a leap of faith, because I think so many of the new healthcare solutions that are out there provide so much better hands-on care. What I'm really seeing are the ones that are succeeding, the big, the huge dollars raised, $400 million. Those that are done by, tech people, they're failing. We're seeing these shutter down right and left. The ones that are succeeding are the physician-led solutions, because their physicians are motivated to bring care back into healthcare and trust back into healthcare. And I heard Brene Brown talk about AI, and there's nothing more annoying than getting on with a bot and you can't get out of that vicious circle on the phone. Yeah. I mean, or even, on a text, on a call center, it's just terrible. We really, everything that is during work hours that is patient facing is real people at Green Imaging. We feel like that is our differentiator. And we feel like consumerism has to some degree failed in healthcare. People, when they're sick, when they're worried, they want a real person and they want somebody with compassion to deal with them. And so, that is very much in our bloodstream and in how we operate at Green Imaging. And if you ever are bored, go look at our Google reviews, because you'll see what patients say about us. And they call out our concierge by name. And, one thing I don't want to digress, but this is really important, is that the average American right now is spending 8 hours a month trying to navigate the healthcare system for themselves and or family members. That is during working hours. Employers have great concerns about this because the only time you can navigate the system is during working hours.
Right.
So people are actually, there's a lack of presenteeism at work because of this problem. And so I think what you'll find is that a lot of the solutions like green imaging are really focused on taking the workload off the patient, off the member, and making sure that they get the care they need without the hassles. As friction, healthcare, there's friction built in just from the nature of the beast. But we really try to create as frictionless an environment as we can and the best outcomes we can. And that's how you get to value. It's about quality and cost.
Yeah. It's important that we're advocating for ourselves, but at the same time, many of us don't know, and I'm speaking for
Right.
me, and I'm sure others, that we just don't know where to go. And it is time consuming to do the research. For me personally, I'm going through something right now and I need to go see a special doctor. Well, they don't take my insurance. The doctor that I was referred to, that it's part of the group that I'm with that does take my insurance. So it's kind of weird that they don't. So now and the only other doctors that are in my, I guess, my network are an hour to 2 hours away. So I trying to start looking for self-pay options because I'm like, I need the convenience and I'm willing to pay. It's just a matter of where do I find these places. So it is time consuming to spend time doing that. And like you said, there's only so many hours in the day we can do this and be able to reach those places too at the same time, so for researching, like during business hours, we have to make those phone calls. So go ahead.
Well, there is a physician-led solution that does this, and that's UberDoc. And she's actually a thoracic surgeon who founded UberDoc. And she has doctors all across the country willing, especially specialists, because everybody has this problem, and willing to accept cash rates and very high quality physicians on her panel that offer that kind of care, both virtually and in-person appointments. So that's a really good point. I mean, there are solutions out there for most of the healthcare needs that people have on an outpatient basis. It's just finding those and trusting them. I would do enough digging to make sure that, UberDoc has a great reputation, and it does. And, and then trust that, these are doctors who are trying, the doctors on her panel, the doctors offering these appointments are trying something different. They're trying to provide better, more affordable care.
Right. Dr. Dickerson, you are very outspoken about the inefficiencies in traditional healthcare pricing. So what have you learned about how pricing gets inflated, and how does your model avoid these pitfalls?
We don't have middlemen. I think that's the most important thing. And we have one price. We don't, like if you look at a hospital system, they may have negotiated rates with Blue Cross Blue Shield at this level, United at this level. We don't do that. We have one price for anybody who approaches us. And, and we don't, I mean, people say, why don't you publish them on a list? People don't know what they need. And even orders for imaging are written such that the radiologist will protocol it in the setting of that CT chest. If I'm a direct primary care doctor, I don't know if you need contrast or not. I'm just going to write CT chest and let the radiologist protocol it. And so it's very hard for a patient to look at a price list and know exactly what they need. So we get on a web chat with them. We ask them to upload their order or take a snapshot of their order and text it our way, and we will give them a price for that exam. What you don't know, and in your number one, it's very hard to get a price quote, even if you're somebody who's actively seeking that. If you do it from a hospital, they're going to want what's called a CPT code. And it's a code that, that corresponds to that exam. Well, once again, you're not going to know this. You can maybe Google the CPT code, but there are a bunch of different CTs of the chest there. You're not sure which one you need. And you don't know that there may also be a code for contrast. And so they're going to give you a quote for that CPT code. And then at the bottom in the fine print, it's going to say, other codes may be charged. This may not. And then they also have $400 of variance that they can allow in that pricing. And so they can just charge you $399 more than that and get away with it. And so there's a lot of transparency in that arena. The other arena that's been very interesting and very eye-opening over the past years. There's a lot of light being shed on markups. Okay, so the employer, so let's say Blue Cross Blue Shield pays a doctor $450 for a CT scan. It may be charged to the employer at a higher rate because they've actually, maybe they didn't have an agreement with that doctor, but they went to an alternative network and used that alternative contract to get that price. Then they charge an alternative network fee that gets marked up because it's in the contract with the employer who hasn't read their contract, their 600-page contract completely, or can't understand it. It gets charged at $850. And the employer has to pay that. And so there's a lot of what we're calling TPA spread right now. There's a lot of money in there that's kind of going to middlemen. And it's going into the pockets. We know that the what we call the BUCAs, the Blue Cross Blue Shield, United, Cigna, Aetna, that, United's still making record profits despite everything else that's gone on. And so, there's a lot of profiteering happening there. And so I think if you can get rid, and that's a lot of what my book is about, is if you can dump a lot of the unnecessary, they're good middlemen out there. I think people who help you navigate the system are incredible. Those are the people we need in healthcare, but they're middlemen who are not providing value in the healthcare formula. And that's what we've got to get out of there. It's that bloat.
Yeah. So employers, let's stay with them. They're increasingly frustrated. You just said that they can charge them a different amount by the rising healthcare costs. So what role do you see the companies playing, or what role can they play in creating more efficient care models for their employees?
Yeah, and this is really an important topic. What they can do is get everything they can. Let's get the healthcare separated from your health insurance. Use that Blue Cross Blue Shield plan. Go with the highest deductible. Use it as catastrophic coverage. Start paying more affordable rates for healthcare. Start paying making sure your members, my employees, and their families have access. It's not direct primary care. It's called advanced primary care. Next level urgent care in Houston. Actually, they're throughout most of Texas now. They have on-site urgent care 12 hours a day, on-site primary care 12 hours a day, 24/7 telehealth. They offer labs, immunizations, x-rays. My employees and their families, we pay for that for all of them. They don't miss work for doctor's appointments anymore or for their kids' appointments. They've got access to care 24/7. And that's the first thing I did as an employer, was make sure they had that care. And then, start looking at things like if you're one location employer, you might be able to direct contract down the street with an imaging center and get great pricing. If you're national, or if you're more regional, talk to Green Imaging, talk to other solutions out there. They're bundled surgical options. There's some big national ones. And again, Texas Medical Management does it throughout most of Texas. These are options where when people need non-emergent surgery, they can go get it for a small fraction of the cost that it would cost in a hospital, and they get better outcomes, fewer infections, fewer readmissions, and they get much better care. And frankly, the doctors get paid more. The doctors are getting rooked by the hospitals. And so the doctors are willing to go to these ASCs, to go to these independent facilities and do these surgeries. And so, you start pulling labs in, I know employers are pulling fertility clinics in as an option for patients. You start looking at what your employees need from a health standpoint and get them that care more affordably. Keep your catastrophic coverage. Ultimately, they can self-fund for, something that's even more catastrophic than a Blue Cross Blue Shield plan would be. But start separating out healthcare from health insurance.
Yeah, I love that. So I'd like to talk about your growth. You've grown to all 50 states in the past 15 years, which is phenomenal. So can you tell us how are you doing that? What are you doing? Are you marketing wise or visibility wise? What are you getting out? How are you getting Green Imaging known in order to grow that quickly and across the entire country?
I do a lot of public speaking. I speak to advisors, people who sell insurance plans. There are a lot of reform-minded people who are saying, okay, here's the problem right now. People are selling traditional insurance. Every time that premium goes up 22%, they get 22% more in commission. That's a malaligned incentive. Their new healthcare, health plan advisors out there who are willing to work as consultants and really change that formula so that they're giving you advice that holds down costs. So I speak to those. We speak to at HR events, at human resource events. We get the word out that way. The book, speak to C-suite groups. The business owner CFOs really get this. This is their second biggest line item. It is the cost of healthcare. They're starting to listen more. I speak to patients. I speak to medical students. Really getting the word out that way has let us have really nice organic growth. I think the other thing is happening is the healthcare economy. When I would discuss this with people 5-10 years ago, they didn't get the problem. They didn't see what we were seeing, then that has now just exploded. And so, now I think, again, with the subsidy for the ACA plans going away, it's exploding faster. And so as that economy has shifted, we have larger and larger employers coming our way. And so that's really what's and I think success. Things like the school district of Osceola County in Florida, 6 years there, and 80% of the imaging happens in green imaging, not over in the health plan. Only about 20% happens over in the traditional health plan. And so, we're getting successes that show employers that they really can do this. They can actually give the patients at zero out-of-pocket imaging, no cost to the patient, and still save 30 to 40%. I mean, that's a no-brainer for employers. It's just getting the word out.
Absolutely. So what's next for you, Dr. Dickerson? What's next for green imaging? Over the next 12 months, what are the big goals?
The big goals are we have some really large health plans, not so much employers, unions in our pipeline. And it's really getting care to those people, really scaling this so that we can, and I think especially union members, what we find is the people who really use us and appreciate us are the people who are out there working hard and, they're struggling to get the care they need, get their family members the care they need. Those are the people who will go the extra mile and not go down the hall at the hospital and get to green imaging and get the care that they need more affordably. Those are the people we really have tremendous success with. So I think this next year, it's about scaling without losing inequality. I mean, that's critical that we don't lose a Google star. Nothing happens where we're not providing excellent care. And so it's really getting to large groups of patients the better care that we've been offering for the last 15 years.
Dr. Dickerson, you mentioned AI earlier, and it's very people focused and people oriented. You want your people to talk to somebody, and there is nothing more frustrating than getting in a loop. I get so aggravated with my cable company anytime I need to call them because I can't seem to get a person on the phone. And I always find myself yelling at it, and I'm like, it's always fun. And I'm grateful I only have to talk to them about twice a year. And AI is getting better where now you can kind of move people to a phone call or to a person if needed for those people who are using it on the front end. Since you don't use it on the front end at all, are you using any AI? Have you maybe in the back end systems to support the efficiency on the back end so that you can have more time on the front end with your patients?
Absolutely. That's our whole goal, is to keep the staff we have, but move them to the front and take the back office, totally automated. So that's our total goal for that. There's some things that make radiologists better. There's things that make radiology machines better. I love when somebody doesn't have to replace an MRI machine and instead can use AI to improve it to 3T quality and decrease exam time by half. I mean, that's fantastic use of AI. Another is, that I've used in my radiology reporting is it organizes my report for me. So I no longer have to dictate it box by box, fill in the blank and keep my focus over here. I can just dictate what I see and it organizes it for me. And I love that. And I think the third thing that we're seeing are some clinical applications. Some of the clinical applications I think are risky. I would not trust AI to read an exam at all. Now, can they make us better as radiologists, bring our attention to something? Absolutely. That's still a little risky. I mean, in fact, my malpractice would go up if I were using certain things, and I'm not going to do that. I think a trained radiologist's eye is still better. But there's some clinical applications, some quantifiable things that it can do that are just fantastic. So now I can take a chest CT and run some AI software, and I can turn that chest CT into an exam that it evaluates coronary artery calcium, the calcium score. So from that same CT, I don't have to do another CT. I can evaluate coronary artery calcium. I can look at cardiac chamber sizes. We can look at liver fat. We can do so many great things with that. And bone density is the other one. I can run a DEXA scan. I can run a bone density. It's even better than a DEXA scan off of that same chest CT. So that to me is really exciting when we can really quantify. I've always been able to say, I think this person may have osteopenia. The bones don't look very dense. Now I can quantify that. I just love that. I love being able to, and that's all population health information. My DPC doctors need to know those things because they want to take better care of those patients. Those are the kind of things that help people live a longer, healthier life. So that's the most exciting thing that I see in AI.
And that's great that you can get those quantifiable scores or information from the same scan, because that one helps the patient not have to go and take time for another test somewhere to get that information. And I love that because I know for me personally, we have all busy lives, and the less scans we can go to, and it's safer to less scans we're putting our body through is right. Also more healthy for us overall. Okay, let's do this question. I love this question. If I could hand you a magic wand, Dr. Dickerson, and you can wave it over one issue or challenge you are having right now, and you can, in the growth of your business, and you can go poof and take it away, what would that be and why?
It is first dollar coverage for HSA plans. The people who are smart enough to buy an HSA plan, because it is the best savings vehicle, it's catastrophic coverage, and it's the best savings vehicle on the planet, are limited by the IRS, and that their employer cannot do first dollar coverage, can't do green imaging. You have to pay it out of your HSA plan. And most of these employers are not funding the patients are having, and patients don't have money right now to buy health care. And so it's keeping a lot of people who really need our care, this IRS rule, from being able to get it. And it's so frustrating. And the patients get frustrated. They hear that, okay, so they hear, oh, we've got green, somebody will tell them in their workplace, we've got free imaging through green imaging. Uh-oh, they selected the HSA plan, so they don't get it. They've got to go pay for it. And it's a conundrum for us. I love the idea of HSAs. IRS needs to rethink how they're doing this. And, right now they allow screening to be first dollar coverage. They need to allow diagnostic too. People just aren't getting the care they need with this model.
Yeah. So going back to AI, because it's a hot topic now, and it's not going away. Are there any things on the back end? Because for your practice, I'm sure other clinics are feeling the same thing if you're going through it. Are there anything that you wish AI could do to take off your plate right now?
Yeah, and we're starting to see it. It's the intake of patient data from so many sources. We get it by fax. We get it by email. We get it by phone call. We get it by, it's coming, by SFTP server. We've got to go into web portals. Data is so dispersed. And we're starting to see some products that can unify that data, turn flat information into data, extract, from a doctor's order. We still get doctor's orders on a prescription pad, handwritten, extract that into data. Even with doctors famously bad handwriting, be able to extract that information, turn it into data so that we can take care of people promptly and easily.
It's kind of surprising you're still getting handwritten prescriptions.
Oh, I would say maybe 25% are still handwritten prescriptions.
Wow.
And maybe that's because we tend to have independent doctors and doctors who are not on Epic system. Hospital systems are going to send to the hospital system. We tend to have people who are in alternative models.
Got it. So before we wrap, if you could give one piece of advice, and I know you already gave advice, but maybe this could be the same, and maybe we're just going to drive this one home, or it could be something different. If you could give one piece of advice to employers and individuals navigating today's healthcare landscape, what would that be?
It would be getting away from consumerism. It's failed. It just didn't work. You just can't count on people to go shop for a surgery. They don't know quality. Even doctors struggle with that. You've got to find the right solutions and put them in place. And they're not the same solutions for every health plan. A school district is very different than a Teamsters union. They have very different needs. One is male dominant, one's female dominant. They're just different entities. And so you've got to solve the healthcare needs of your employees with very caring, hands-on solutions. And when you do that, you're going to see your costs plummet because people are going to be cared for.
So how can people connect with you and learn more about green imaging?
Yeah, our website is greenimaging.net. Greenimaging.com will take you to Canada. We're greenimaging.net. And, we have all kinds of different, you can web chat with us, you can do whatever you want. And my email address is Dr. Dickerson, DRDICKERSON @greenimaging.net.
Amazing. So make sure you reach out to Dr. Dickerson. And you said something earlier, and I loved it, that you give pricing. So they just need to send in, we just need to send in what our order is, and then you'll be transparent. You don't know how many doctors I've called and I said, okay, well, what's the self-pay? And they're like, oh, I don't know. And then I have to, and then they don't get back to you. So I wish that every doctor would understand that sometimes we get to self-pay. And it would be really helpful if we knew that sooner, like if they had both of those pricing, because I think a lot of them just rely on the insurance. And then if it's not covered, it's like, go find someone else, where there are people that are willing to do the self-pay. We just need the information.
Correct.
So I love that you're very transparent and open about that. And it's very clear. If you're listening to us watching us on YouTube, please share this episode if you know anybody that could be supported. And I think everybody, whether they're employers or employees or individuals looking for insurance or even just care. So let them listen to this. Please share this episode with them and Dr. Dickerson, because this is a lot of valuable information. I learned a lot today. And I know that other people need this information as well. We need to be advocates for our healthcare. Nobody's going to advocate, no doctor, as much as, even if you were with an independent doctor, they're still not, you're the one that needs to advocate for yourself. You need to do the research and make sure that you are getting the insurance and the healthcare, both of those that you need, and that's best for you. Because like Dr. Dickerson said, it's not a one size fits all. If you are listening to us on your favorite podcast platform, thank you. And we'd love a review. If you can hit that 5 stars, this helps us push this episode out to more people. And the world needs to hear this message today. Definitely. Thank you, Dr. Dickerson, for being here. Before I let you go, is there anything that you'd like to share that I didn't get to ask you or we didn't touch on?
No, I think there's hope, though. I'm seeing a tremendous change in the ecosystem in which I practice. And I think patients are going to start having more access to that, and it's going to be more widely dispersed. So I think there's hope for changing healthcare out there.
Yeah, right. I hope there's always hope. And that's very exciting that you feel that there's hope there. So I'm excited about that. And thank you all for listening. Make sure you go connect with Dr. Dickerson. Go to greenimaging.net to learn more. All of Dr. Dickerson's information, her bio, is in the show notes as well, and how you can connect with her and also reach out to Green Imaging. I knew I was going to say that once. I made it through the whole interview without saying it. Greenimaging.net, and go grab Dr. Dickerson's book, Align. You can grab it at Amazon or Barnes & Noble. So Dr. Dickerson, thank you for your time today. Thank you all for listening to us. And I look forward to seeing you on the next episode of the Business Growth Spotlight.